And you're a liar, Dr. Emer.
Hey guys, it's Dr. Emer. We're doing male facial sculpting now, and you guys know we do a lot of male feature enhancement. Today we have a beautiful younger male who already has a little bit of a striking sort of jawline, nice neck. He's starting to get a little bit of lost volume and sort of sagging in the mid face and around the mouth. And I just want to give him more of a bold look. So, projecting and widening the chin slightly, softening the folds, lifting the cheek, and defining the jawline. Also doing a little lip feature enhancement is really going to give him that more masculine look. Remember, immediately after fillers, everything looks overdone. So today he'll look like it's like overdone. It takes about a week or two to settle in, and then if we need to do tweaks, we do tweaks. But typically, it looks really good, and then we're set for our 9 to 12 month time period. I'm gonna slide in front of you guys. I'm gonna start on his chin, and the thing is, he already has a nice sort of structure. Sorry for the little bit of pinch. What we're gonna do is just bring it forward slightly and widen it slightly. So I want to give him a really squared look. We're using Radiesse, We're using Radiesse, which is a calcium-based filler, and this will allow us to give him more lifting and defining here. That will last him a little bit longer, and he'll start to feel numbing. Matthew, that's where you hold in between. As I said, opposite side of me. Other side. Okay. Perfect. So we're going to keep following right along the bone. We're just going to widen it slightly.
And tell us why it's important to put filler on the chin.
This really will help define out the jawline, and it improves the neck area. As we age, you guys, the chin recedes and the mouth sinks in. And so one of the areas really we want to focus on building out. Plus in men, squaring this off gives a nice improvement in the overall look of the jawline, which is really what we're looking to do with him here. Sides.
So where else can you inject filler?
Well, we're doing it all over the face, you guys. Today, we can do facial sculpting for jawline, for chin. I'm bleeding there, Matt. We're doing for jawline, chin. We can do under eyes. We can do cheeks. No, stay over there. Stay over there. Okay. So now we're gonna work our way over to the jawline, and you can tell them how.
Right, so you just add some fillers to the chin. So obviously you need some fillers to the chin to have a better projection. See, the chin matches the nose. Matches the lips.
So you see, like, as his nose comes forward, we're gonna volumize his lip and his chin. Go ahead and let go. Perfect. So we're gonna just gonna do a little bit more on the chin, just to balance things out. He'll probably feel a little numb now. He naturally has a little cleft here. I don't want to get rid of it completely, but I do want to straighten everything out. Now what I'm gonna do, turn a little here. We're gonna follow along his jawline. I don't want to make it too robust, but I do think he really does want a little bit more of a 90-degree angle. So I'm going to move over here. We're going to follow that 90-degree angle. We're literally just going to define out the edge of his mandibular border. Some people call it the gonial angle. We're going to define there. We're going to hold there. We're going to need a Q-tip as well. We're going to switch sides. Switch sides, grab a Q-tip, make sure we're rolling. What questions are they asking?
So they're saying hello, heart, thumbs up. Dr. Emer's the best.
Thank you guys. So look straight a sec. Just want to make sure we make this very even. Because with him, you guys, he has a little cleft on his chin. So naturally, we really want to make sure this gets perfectly even. Also, it changes the smile a little bit with the numbing medicine that's inside here. So we have to take that into account. And now we have a more bold chin. Now turn to the left a little bit. Again, following this gonial angle.
So they love the eyes.
They love his eyes. We're going to enhance them now. Everyone's going to take a look at his face and his eyes now. They're going to stand out. Perfect. So I'm going to have to watch this side. I'm going to still go on that side. Just hold that over there. Make sure it's not bleeding.
Is it painful to add fillers?
that a question for me?
Well, yeah, it could be for you. Yeah. Is it
Oh,
painful? No.
Yeah.
No. How long until these fillers settle in?
Well, these will take about 2 weeks. Go ahead and turn back. Go ahead and lift your chin up. Perfect. Again, we're going to define now a little more on the angle. Always looks a little bit more right away, so I want to kind of overdo it a little. Yeah, actually bleeding on that side. No, stay on that side. Over here. Over there. Look around here. There you go. Hold pressure, not rub. Pressure. Good. Bite down for me a little bit. Relax. Good. I want to be able to see where his musculature is so we can really define out the angle. Perfect. Okay, now he's going to come back over here. Go ahead and you're going to massage and rub that area. And go back to the other side. We're just building it out, guys.
That's the jawline, right?
Yes, we're building out the jawline.
He's already did the jawline.
Ramson, tell him
Yes,
why you
could
wanted
see
the jawline. Why do you want your
the
jawline
chin.
done?
I just wanted more of like a 90-degree angle and more structure.
More of a sculpted look.
Yes.
He likes having more of the angle, and you guys can see now it's going to be really defined here. We're going to build it back a little bit for him. He got a little more deficient actually in the posterior portion, so we're going to define it out more superficially.
Hey Barbie, so what's going on here is he's doing facial sculpting, male facial sculpting. So he just did the chin, he added some fillers to the chin, some to the jawline, which as you can see now, you can see the projection of the jawline. It's more of the, see that? More of a contoured, chiseled jawline.
Really good. It bleeds easy. That's okay. It means you probably won't bruise actually. Now, some people will go and define a little bit through the jaw in this direction. I don't want to overdo that because I really want him to have a little separation. It gives a more structured look when you have a separation between the chin and the actual jaw. Go ahead and hold there now.
And again,
I'm
check,
gonna go to
these
this.
are the results right now. You can pretty much see the results right away. So jawline.
I'm going to go to his cheek and under eye right now while the jawline sort of settles in. Again, he starting to notice, like a lot of guys do, this sort of little line here. His eyes, I don't want it to look tired. So we're going to give him some sculpting. If you did a cheek implant here, he would actually be right on bone and going across in this sort of horizontal vector. So we're going to do that. We don't want him to look feminine, obviously.
Name the product. What product
This is Juvederm Volluma. And this is going to last a little bit longer for a man, but
Can
be
you
a
see
little bit
the
softer.
other side? Can we see the other side before?
Yeah, hold
of
on.
course.
Let me just put the product in.
No, I know.
Right
I'll
now
wait on
he's
it.
swelling a little bit, so I want to just hold a little pressure there. You're good. Just hold pressure now. Everything is about going a little slower. Yeah, see, he bleeds easily, so we want to just...
Radiesse is hyaluronic acid.
No, Radiesse is calcium based, remember. Go ahead and hold here, Matt. I'm going to switch with you. No, come around. Always from the top. Good. So we're now using hyaluronic acid, which is the Volluma.
Can we lift a little to see the difference on the sides?
Yeah, lift it a little bit. Right now he's going to be a little swollen. That's why I'm holding pressure there. Go ahead and lift.
So you guys can see
So
there's
you
a
can
little
see
more
there's more of
projection.
an angle there. And that's what we're going to start here. I just want him to hold firm pressure because guys tend to want to bleed here a lot. It looks way more swollen than the actual result of the product. And so it'll look kind of...
How many sessions are needed for the jawline? Just this one session?
Well, look, he does the
Like-
one, and then we take a look at the result of it.
Like that's just one. That's the contouring you see at the bottom of his jawline, that concaving. That's just this one time.
Let me see. Go ahead and let go of both. Yeah, so I want you to hold right here because that's a bruise. So that right firm, right above, firm pressure. So wherever there's a bruise, you just want to hold firm pressure because that will allow you to actually see the result. So again, I'm trying to give him some lifting and some structure here even if you were to do an implant, it would be swollen and sort of settle over time. We're not doing that, but I do want him to have structure back here with a little definition, because that's going to give him that more chiseled look in the future. So it's going to balance also what we're doing with his jawline, and it'll soften a little bit his under eye area.
So someone's saying, are you using different products?
Yes, we are. We're using the Radiesse along his jawline, but we're doing the Volluma. Yeah, see.
Is there a reason why you do that?
Yeah, I just want a little softer look for him in his cheek. Go ahead and hold here.
Off subject, do you prefer Botox or Dysport?
Depends. I use both for different reasons. And so look, we settled in a little bit of bruising. That went down a little bit. Now I'm going to focus on a little bit of his under eye sort of area. I want this to get a little lift there so he doesn't look as tired or anything. We want his eyes to pop.
So from the profile, you could already see there's some more more cheeks.
But what I'm trying to do again is this horizontal build, you guys.
So you feeling any pain? I mean, you guys could see he's just...
He's actually super strong. I know there's pain, but he's actually not saying that he is.
It's not that bad.
So it's not as bad as you think?
No.
All right, I'm going to take a quick look. Let me take a look at the balancing right now. Obviously, this is a lot of swelling that's there that will go down. But now you can see there's improvement there. And now there's lifting that's going to be here. And you see that coming back horizontally? That's going to blend now with that 90-degree angle. Look at his jawline. Look at his chin. We're going to finish that up now, and then we'll go to the lip. Go ahead and hold pressure there, Matthew, on that one side. I'm going to do a little bit more to the jawline. And just a little teeny bit more to the chin in certain areas for touch-up. Good. I just want to make sure it's even. And looks structured. Turn this way, bite down for me. You can see that 90-degree angle. Go ahead and relax a little bit. We're going to build that up a little bit more so it's a little more defined on the border. Bite down again. Great, relax. Perfect.
Now, one of the reasons we do these lives is to show that this is what it looks like when you're doing it. We don't show chisels before and afters. We show
exactly.
the
I
entire...
want people to understand it's a process. And also, a lot of times it takes a couple treatments to get to where we want to go. And then once we get there, we're set for a year to year and a half. So most people are super happy after they do the treatment, and then they want more. So go ahead and now hold pressure on the other side.
Don't put like, God damn, that jawline.
So again, I'm holding pressure, taking a little time. Okay, and again, obviously all this sort of light swelling will go down. I'm gonna do a little bit more into his fold here. Good. And then bite down again. So there's his jawline. We're gonna elevate the jawline just a little bit more.
So for those asking how much it is, unfortunately it's not like it's not the same for everyone. So if you were to come here today, you probably won't have the same facial structure as he does.
Relax. It all depends on the type of filler, how many syringes. There's a lot that goes into it. But in general, you guys, if you're doing full facial sculpting, it's not going to be inexpensive. Bite down, or smile. Good, relax.
Yes, Victoria, that's the filler.
Right at the... Okay.
It's a calcium-based filler.
Okay, let me see from the front, you guys.
Dr. Emer is hot.
Wow. What did it say?
Dr. Emer is hot.
Thank you. So again, I want to do it enough to where in a couple weeks when it settles down, he's happy and doesn't need to do more if he doesn't want to. That's what we're trying to do. Okay, so that's it right now for the jawline and chin, and we're going to go to the lips now. So now I want him to take his ice pack. We're going to wipe you a little bit here, clean you off. Yeah, go ahead now, kiss the ice pack. Let's do the lips.
Lip filler again. Male lip filler.
Do you want to clean down after
That Prince case said, take my money.
Go ahead and take that down a sec. Alright, so my key with him is let's just take his lip that he has and let's just enhance it a little bit. I would like to increase the size of the lower a little bit define the Cupid's bow slightly. That's what we're gonna do. We're using Juvederm Vollure. It's softer and lasts a little longer. Remember, if you see here his lip, you don't want to extend it too much because most of his volume is in this middle area. So we're gonna go really little.
Dr.
Yeah,
Emer.
sorry.
Dr.
Yeah?
Emer's iconic. I've seen his technique before. I'm looking for some work. Is there any type of anesthesia or something that we just do numbing cream? So he just had numbing
Talk
cream.
anesthesia, you guys. We're talking. So look, you guys can see just that little bit, how much it plumped the pillow of his lower lip. Again, it's the same thing. It's going to be very little. We don't want to extend it too much. Good. Want to keep his natural shape. And then I'm going to move a little this way. And do just a little outline on the angle.
Why is it that thing? Switch.
No, leave it. Perfect. Again.
Dr. John Acosta, prices they're all different. So
So now I'm gonna go to his
anything for the
upper-
forehead, just in his like for his case or anyone else. Do you put something on the forehead?
To what?
The forehead.
Forehead filler?
Yeah.
You can, sure, if you want. He doesn't need it. Relax a sec.
Do
I'm
you,
gonna
do you
focus on
recommend any
his
skincare
Cupid's
routine
bow.
before any filler?
Yeah, we have a whole protocol, you guys, on what you can do. Contact us at emeragecosmetics.com so we can get you a virtual consult. I'll switch to the other side now. He's doing really good. Kiss the ice
So
pack again.
before we go on to the other side, tell us what's
I'm
the
going to show you
difference
what we
between
just
one and
did.
top
Again,
lip.
Juvederm Vollure.
And tell us why the top lip and Cupid's bow is so important.
Especially for signs of beauty, go ahead and take it down. We want the upper lip to have more show and we want it to have an angle. So we increase the size proportionately on his lip here, and then now we define out the Cupid's bow on the one side. Now let's do a little on the other. And the big thing here, you guys, we really want to get a nice angle and lift. And
Yes, Victoria, it's just cream.
he has a different shape on each side. So what I'm trying to do is even it out, but I don't want to change his look. So I wouldn't go crazy, you guys, with so much about symmetry. Go ahead and ice again and take a look. Don't go too much about symmetry because you want to really just take the look you have and enhance it. It makes you look like a better version of you than a different version. All right, let me see again. That looks phenomenal. I think people are gonna die over this magic. So I'm gonna do a little definition in the Cupids.
Love
There.
doing medical aesthetics. I'm fed up with cosmetic plastic surgery.
All different. Perfect.
What's your thought on lip implants?
You know, if somebody really needs it, I think nowadays we don't need implants given how good our fillers are. Let me see the other side. I think especially these fillers, they act as implants. And this is like an amazing lip. So you guys will see.
How long does this effect last?
So lasts 9 to 12 months, sometimes a little soon, a little longer. I think that's pretty good in terms of the lift. The only thing I'm going to do now is just do a softening along its chin crease. Obviously, the chin size is a little larger now. It's going to go down, and then that's it. So obviously, a different look for a male versus a female in terms of the lip, but we defined out what he has, and I think it looks amazing. So we're going to do an Emer reveal. Even though he looks swollen. But this is the thing. This is what we want to do. And we're going to show him. So go ahead and grab the let's do the Emer reveal. Which one?
The one on top.
This one?
Yeah.
Okay, you guys. So we're going to do Emer reveal right now, showing the swelling and the results.
Yes, he is none before
Take a
injecting.
look. I'm going to raise you up. Let him be in the light, you guys. Let him see the light. Hold on.
Looks really good.
You can like
So, what did you want? Tell everybody what you wanted.
I wanted like more masculine jaw, and
So look at yourself straight on. Take that in there. Bring it a little closer. Okay, now I want you to bite down so you can see your jaw. Don't smile, just bite. There you go. So now turn a little bit. Obviously it's a little swollen, but much more of a 90-degree angle.
yeah.
A little broadening of the chin and projection. Lips, I think, are more balanced. Soften the folds, and then now we're gonna have a lift here. If you turn to the side, you're really gonna get this part will come up and kind of lift this area like this over the next few weeks. I also feel like it helped your under eyes a lot.
Yeah.
Turn the opposite way now. Show them here. Turn this way. Look at that jaw. Bite down. See it?
Yeah.
So much more on this basically right here. Chisel, cutting.
Yeah.
And then go look at the lips. Go up close. Look at this.
They look really good.
Don't you think?
Thank you.
A little
Yeah.
more lift, a little more softening.
Yeah.
But what are they saying? He already has full natural lips. Can the columns be full? Oh, good question about the columns. He's not a column person. Look at his lips. Let me show you. He does much better without having those. If you have the columns on him, it'll make him look too feminine. We're keeping him masculine. So now let's do the regular mirror.
So he's so beautiful. I'm next place.
Oh, thank you.
I love you.
I'm at I love it.
So now in the mirror, take a look. And obviously, you know, it all settles in and we'll see everything, but
Yeah.
this is the true sculpting, the finding out the jawline, lifting the cheek, giving a little more projection in the chin,
Yeah.
softening the folds, helping the eyes, and doing the lips.
How long till the bruising goes away?
I tell people it's going to go away within a few days, but 2 weeks is when you really know that's the result of the look. And
Yeah.
for him, he's going to have much more of a chiseled look and have much more definition. It's going to be really great. So another successful case, male facial sculpting. We're going to follow him today, tomorrow, the next week, too, and then you guys will see the transformation. Awesome. Okay, now you guys do your pictures, and I will do random. Do a little bit of the testers.